What's up, buddy? I'm running a little short on time here, so I'm shooting a video and I'm going to send it over to you, hopefully, because it's easier to talk about my ideas than it is to write them down and send them. So I don't know how long this video is going to be, probably a couple minutes, but hopefully you can take it and kind of roll with it. So I think one of the biggest limiting factors that we have to try to motivate people to get better and get healthier is the fact that we have been trained literally since birth that there's really nothing that we can do to get healthier, that it's controlled by our genes. This is taught by the medical system, the healthcare professionals and experts, and there's really nothing that you can do to get better or get healthier. We all have a loaded gun, and that gun's either going to tell us that we get heart disease, cancer, or diabetes. And it doesn't matter if we eat the piece of pizza or we go for a walk. It doesn't matter if we eat an apple or a pastry. And I'm here to tell you that nothing could be further from the truth. So if you were to ask me or I were to ask you, is there anything last week that you did that if you didn't do it, if you didn't do that activity or that behavior, that you would be healthier today without it? That's an absolute truth. Everybody would say yes to that. And if I were to ask you, is there anything that you didn't do last week that if you did do it, you would be healthier today? Absolutely. That's an absolute truth. When you ask people what's the most valuable thing that they have or they possess, their family, themselves, it's their health. They can't do anything without it, and if they want to be independent and free, they have to have it. So all of us listening to this video, you, me, we're a role model, we're a leader, we're in the community, we're an aunt and uncle, we take care of children, we take care of small groups at church, whatever it is, right? We all have some type of role that if we were healthier, those roles would be a lot easier. And me and you included, even though some of us might be working out 6 days a week, doing yoga, eating healthy, seeing a chiropractor weekly, whatever that is, some of us, all of us, every single one of us could be doing more to have better health. Every single one of us could be doing that. That's an absolute truth. So there's something that we need to do to bridge that gap, right? So we all know that there's things that we could be doing that we're not doing, or things that we're currently doing that's hindering us. How do we close that gap? And if we were to make it simple, efficient, affordable, possible, I think it has to be possible. And if you were to do those things and get better health, everybody would do it. The most important thing that you got to know is that most people don't do something because they believe it doesn't matter. Just like, they're unwilling to give up the cigarettes, the beer, the pizza, and they're not going to set their alarm at 5 a.m. the next morning because they truly believe that the behaviors that they're doing really don't matter. That's because they believe that health is all or nothing. And if they're not doing all of it, then any type of healthy behavior that they're doing isn't going to matter. And I'm here to tell you that the carrot that you eat is not going to get canceled out by the pizza. That if you decide to go to a movie Friday night and sit there for 3 hours and eat popcorn, it's not going to cancel out your workout. Every good behavior, whether it's a good healthy thought, you wake up and you think of 5 things that you're grateful for, a loving thought, good food, healthy food, movement, exercise, those behaviors are not going to be canceled out even if you decide not to exercise today, even if you decide to have a piece of cake after dinner, even if you decide, or it might be something that you just don't decide, you just have a bad day. Those bad behaviors and things do not cancel out the good ones. The only thing that's all or nothing in life is pregnancy. You're either all the way pregnant or you're not pregnant. Health is not that way. Every little decision has a compound effect that changes your physiology long term. And it's possible and it's attainable for people to have. So I think in order to make that thing work, you just need to make it simple. Like, everybody can eat a raw fruit or a raw vegetable with every meal. We're not asking you, I'm not asking you, nobody's asking you to cut out your pizza and your fried food. No one's asking you to do that. But everybody can add some raw fruit or vegetable to their diet. Everybody can walk 15 minutes a day. And if you do that consistently long enough over the next year, those positive changes will have a positive impact on your health. Almost everybody can agree with that. Almost every single person. If you meet a person that's just like, no, that's not going to work, those people are not going to make a change, because nobody moves towards no one moves towards deprivation. If they feel like they're being deprived of something, deprived of life, they're never going to move in that direction. But if they believe they're going to get more out of life by just adding a couple good healthy things and committing to them long term over the course of a year, it's simple, it's easy, it's affordable, it's effective, it works, and it's possible. Those are the people that are going to have lasting change and impact, and they're going to change their health for the better. And it's doable. It's doable for everybody. So if there's anything that maybe you've thought about changing, thinking about changing, you want to add to your lifestyle, make it simple, make it easy, and it works. It works. As long as you commit to it, you're not going to feel a change immediately. You're not going to feel it in the first week. Might not even feel it in the first month. But if you commit to it for a year, it works. Thanks for listening. We'll see you soon.